Hi, I'm Olivia. I'm a counselor in training at CMU. This is a recording. We're recording this. You don't have to be on camera, and I know you could sign the informed consent form stating you wanted to do the session but did not want to be on camera, and that's totally fine. Thank you for meeting with me today. Before we begin, I just want to note that this is a safe place and it's super confidential where we can talk openly about things and what's going on with your life. And the purpose of this conversation is to better understand you as a whole person, your physical health, your emotional well-being, relationships, environment, so on, so we can figure out how to best support you. And this recording will go back to my supervisors and peers to provide you with the best care. You are free to share as much or as little as you are comfortable with. If anything feels unclear or uncomfortable, ask questions and let me know. Do you have any questions before we get started?
No.
All right. What's your name?
My name is Mason.
Hi, Mason. What brings you in today?
I have not been feeling great lately.
Not been feeling great. Okay. I'm going to take some notes to help me as well. And you are free to look at them anytime if you have questions. I will openly tell you what's going on. What is your date of birth, Mason?
January 6th, 2003.
All right. And Mason is your chosen name?
Yes.
Okay. You identify as the sex you were assigned at birth?
Yes.
Which is?
Male.
Male. Okay. You identify as a man?
Yes.
Use he, him pronouns?
Yes.
Okay. Are you married?
No.
No? Okay. These are just questions I have to go through. What is your nationality, ethnicity?
American.
Okay. Primary language?
English.
Do you have a secondary language?
Nope.
Okay, thank you for telling me. Can you tell me more about why you're not feeling great? What's been going on with that?
It's hard to describe. Generally, I've been lacking pleasure in regular things.
Okay.
And small tasks, like just getting out of bed in the morning, are extremely difficult.
I'm sorry you're going through that. What is your expected outcome for therapy?
Go back to normal.
What would you consider your normal?
Being able to go through daily activities.
And what does a daily activity look like for you? Like, what are your day-to-days?
Waking up and going to work.
Where do you work?
I do side jobs.
Okay, that's pretty cool. Do you have any hobbies or anything like that?
Not many.
No, no hobbies.
Nope.
Can you tell me a little bit about any hobbies you may have? Excuse me.
Well, I used to play a little bit of music, but I haven't done that
Music. Okay.
in some time.
What kind of music did you play?
Variety. Nothing
Right.
specific.
Okay. You haven't done that in a while, you said?
Nope.
Any specific instruments?
Guitar, mostly.
Okay, that's cool. And you want to get back into playing guitar?
Yeah, maybe.
Any other hobbies?
Not in particular.
No? Okay. Um, you said you do side jobs?
Yep.
Okay. When did you start with this not feeling great, not being able to get up?
I would say about 4 months ago.
4 months. Did anything else happen at that time, around 4 months ago?
No.
Okay. Do you have any current medical conditions?
No.
Okay. Are you taking any medications, supplements,
Nope.
prescriptions? Nope, none of that? Okay. What is your sleep pattern like?
Probably the worst somebody could have.
Can you describe that to me?
Might be 10 p.m. one night, might be 2 a.m. the next night, might be no sleep another.
Okay. So you're just having a hard time falling asleep?
Yes,
Yeah. Every night?
most of the time.
Most of the time? Okay. Have you tried anything in the past to help you with your sleeping?
No, I like to stay away from any kind of substances or medications or anything like that.
Have you tried any more holistic approaches?
No.
No? Okay. Well, I appreciate you sharing that with me. How is your appetite and eating patterns?
Also not great most of the time.
Can you describe that to me?
A lot of crap. I
Can
eat
you,
a lot of not great things.
what do you mean by not great things?
Oh, junk food stuff you just grab off the shelf.
Oh, okay. Like quick, easy meals?
If you could call them meals, yes.
You want to call them snacks or,
I'd say snacks.
okay. And does this have to do with um, it feeling hard to do small tasks?
Yeah, probably. I'd say so.
Okay. Well, I appreciate you sharing that with me. And how often would you say your eating habits are not the best
Pretty much all the time.
all of the time? Do you use any substances, alcohol, tobacco,
No.
weed?
Nope.
No. Okay. How would you describe your mood today at this moment?
Content.
You content? That's good to hear. How would you describe it lately in the past week?
Not as good as content.
Can you
Less
just
than content.
can you describe that to me?
Wow. Not exactly sure where to start. Um, yeah, I guess I'm not sure.
And that's an a-okay answer too.
Yeah, it's the words to describe those feelings are not coming to mind.
Yeah, I totally understand that. Just feeling less than normal, like less happy.
Yeah, yeah.
Like, are you feeling any like discomfort in your body anywhere?
You mean like physical pain or?
It could be physical pain, yeah.
I mean, yeah.
Where?
I mean muscular pain.
Muscular pain? Have you been experiencing any anxiety, depression, or stress maybe?
Probably.
Probably.
Yeah.
How often would you say that you experience anxiety?
I feel it maybe once or twice a week.
Anxiety once or twice a week? Okay. And where do you think that stems from? Like your belly, your heart?
Uh, I feel it mostly in heart rate. It'll spike up pretty high every now
And depression? How many times a week are you feeling sad or just not feeling like you want to do the normal things you want to do?
and then. Oh, daily.
Thank you for sharing. That sounds very difficult. And stress?
Also daily.
What kind of stress are you experiencing?
Uh, I guess, could you clarify the question a little?
Yeah.
Do you mean like source where it comes from?
Yeah, where it comes from. I'm sorry.
I'd say probably work
Work.
and being broke.
Yeah, financial struggles are a big one. I hear you. Do you have any history of mental health diagnoses?
Nope.
Okay. Have you ever had therapy or counseling before?
I've gone to a couple intake sessions here and there, spaced out over a few years, and it never really developed into anything beyond that.
That was a couple of them over the years.
Yeah, like 3 or 4 years between.
How many counselors or therapists would you say you'd seen in that time period?
Just two.
Two. Okay. I appreciate you sharing that with me. Have you ever had any thoughts of harming yourself or others?
No.
Okay. I ask that because as a counselor, I am required to report things to the state, the government, if you are going to harm yourself or others. So if there is elder abuse or child abuse, I have to contact APS or CPS. And if you're having thoughts of that, make we can call together and walk through that process as well. If you're having thoughts of harming yourself, we can make a safety plan, and I can share that with my supervisor as well to give you the utmost care. Okay?
Mm-hmm.
Thank you for sharing that with me. Do you live with anyone?
No.
Okay. You live by yourself?
Yep.
Do you live in an apartment, a house?
Apartment.
Apartment. How would you describe your relationship with your family and friends?
Um, I mean, not the closest relationship. I might see everybody once or twice a year at the most.
Friends or family included in that?
That would be both.
Both.
Yeah,
Did you say you see them on the holidays or
typically. Yeah.
typically on the holidays? Okay. Well, thank you for sharing that with me. Do you feel like you have a support system? Like you have people that you can rely on and rely on you?
Not really.
That sounds really difficult to deal with, not having a support system. Do you feel you need one?
I guess I'm not sure what the purpose of a support system would be.
Getting the help from people, maybe?
I mean, yeah. I guess I could see the benefits.
Are you currently in a relationship?
Yes.
Is that person involved in your life? pretty frequently?
Yes.
See them? Okay. That's good. How often do you see your partner?
Usually a couple times a week.
Times a week. And is your partner aware of the not feeling great, struggling with small tasks?
Oh no, I keep this all to myself.
Okay. Thank you for sharing. Is there any history of trauma or abuse or any like major significant life events?
No, no, nothing major.
Do you have any cultural spiritual beliefs that influence your life, like Christianity, Catholicism?
Nope.
No. Any cultural factors you need me to be aware of?
Nope.
Okay. Do you feel safe in your home and where you live?
Yes.
And I know you mentioned some financial stress. Are there any other like financial or housing concerns? Are you concerned that you're going to lose your apartment?
I mean, not at the moment, but things could change.
And do you like where you live in your apartment?
It's a roof over the head.
I hear you there. Do you have any strengths or coping skills that you have tried in the past for any issues?
Um, no, nope. I wouldn't even know where to begin with any of that.
Do you have any things that like help you cope with stress when you're feeling it in the moment? In the moment?
No,
No.
no.
Do you have goals for counseling? Like what you want to, other than getting back to, getting up and going to work?
That's pretty much it. Just figure out if there's, I guess, something wrong with me and if it can be fixed.
Okay. Yeah, that we can absolutely work on getting you back to getting up and feeling happier.